So going to types of RRT, okay, dialysis. We're going to talk only about dialysis today. We're not going to talk about transplant. So dialysis of broadly two types. I'm sure all of you are aware. There is hemodialysis and then there is peritoneal dialysis. Okay, hemodialysis, wherein you purify your blood to an extracorporeal circuit, and peritoneal dialysis, where we use our native peritoneal membrane as the dialyzer. Okay, we use our native peritoneal membrane inside the abdominal cavity for the purpose of dialyzer. Okay, and in hemodialysis, you have an intermittent hemodialysis, which is IHD. IHD does not stand for ischemic heart disease. It stands for intermittent hemodialysis in this context. Okay, there can be intermittent hemodialysis or there can be continuous renal replacement therapy. CRRT stands for continuous renal replacement therapy. So in the setting of acute kidney injury, critically ill patients, patients who are in septic shock or shock of any other etiology, CRRT is the choice in acute kidney injury. Okay, because it is much, much safer for the patient. Peritoneal dialysis, again, you have two, wherein you have manual exchanges, continuous ambulatory peritoneal dialysis, manual exchanges done 3 times a day. Okay. And then there is continuous cyclic. Okay. There is a continuous cyclic peritoneal dialysis, wherein you use a machine called a cycler, which is connected to the patient at night, and then dialysis happens overnight when the patient is sleeping, and in the morning they disconnect it and they go to their work or school or college, depending on the patient. So there is a CAPD and there is a CCPD. In CAPD, things are done manually by the patient. The exchanges of fluid into the abdominal cavity and the drainage of that spent dialysate is all done manually. Whereas in CCPD, you use a machine called a cycler, which does this, putting it in and taking it out.